Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss few important questions from Genitourinary System for your 2025 CPC exam. So when it comes to 50,000 CPT chapter, here as you all know, we will be getting 6 marks question, but this 6 marks will be separated or distributed based on the section. So like first urinary system, it includes all the kidney procedure and other important procedure as you all know. So in kidney procedure, nephrectomy, nephrostomy, so all those very important. Coming to female genital system, and there also you'll be getting 2 marks question, and same way male genital system. And at last we have reproductive system procedures. Okay, from that reproductive system you may expect in case study. If not, it will come in chapter wise question. Okay, so you have to make it section by section, and you have to make a study plan. So here let's discuss all of these important questions as of now. And maybe day after tomorrow, I'll try to cover nervous system also. So actually, prior to this recording, I started recording this class. I mean, this recording around 8 o'clock. Okay, 8 to 8:45. I did complete recording and I completed all this question explanation. And later I am seeing that class I not started recording. I felt really bad. Now again I'm doing. So yeah. So first question. 56-year-old female is post-menopausal with abnormal vaginal bleeding, and the gynecologist, the provider performs hysteroscopy and biopsies the lining of the uterus. What CPT code is reported? So you can see here the question is like not so complete since it's a keyword type. They'll not be having enough complete questionnaire information. So we just have to focus on the actual key procedure and what is the correct code for that. So here our procedure is using hysteroscopy. Using hysteroscopy, they are performing biopsy. Okay, so let's find out. Again, I'm doing the same thing. So you can see, yeah, see already I've explained. So everything is, I told you. So yes, this is, the procedure is under radical and total hysteroscopy. So 58555 says hysteroscopy diagnostic. 58558 hysteroscopy surgical with sampling of biopsy, and 58559 with lysis of intrauterine adhesions. So here in this particular question, we are only having hysteroscopy with surgical biopsy sampling. So 58558 will be the correct answer. 58558 is the correct answer. So next question. Patient present to the hospital based on a clinic in a 12th week of pregnancy. After a series of examination, the provider discovered the fetus would have many abnormalities if pregnancy continues. So the patient decides to terminate the pregnancy. Okay, physician dilates the cervix, cannula is inserted into uterine cavity, mechanically evacuates the fetus and product of conception. Okay, so let's find out missed, the complete abortion code set. So I'll explain the abortion concept first, then we will find the correct answer for this. So here the keyword is the patient decides to terminate the pregnancy. Okay, patient is decided to terminate. That means it's an induced abortion. Okay, intentional abortion. So here you can see this is an abortion code set. So in the abortion code set, we have spontaneous abortion and missed abortion, septic abortion, and induced abortion. Okay, so in this case, first you can see for medical treatment of spontaneous complete abortion, any trimester use ENM codes. Say for example, patient got completely spontaneous abortion. Spontaneous abortion means natural loss. So if she got completely aborted naturally and she is coming to clinic just to take evaluation and medication accordingly, then we have to go with ENM course. Okay. But if she is partially aborted, okay, it's a spontaneous abortion, but it did not happen completely. There is a still product of conception is left out. Okay, in order to remove that product of conception, if she is going to take surgical treatment, okay, you can see 598812 says treatment of incomplete abortion any trimester completed surgically. Okay, so if that is the case, we will use 59812. And next code set you can see missed abortion 59820, 59821. Missed abortion means it is a fetus retarded growth. Okay, fetus will die before reaching some 20 weeks of gestation. So here we have to check which trimester, first trimester or second trimester. So first 3 months you can code 59820. After 3 months you can code 59821. Okay. So next one 59830, treatment of septic abortion completed surgically. So the root cause here for abortion, the root cause is septic. That means maybe patient got UTI, urinary tract infection, then later it further advanced to sepsis, okay, or septic. So because of that, because of infection, patient got aborted. Then you can select 59830. And last set 59840 and 41 you can see induced abortion by dilation and curettage method and induced abortion by dilation and evacuation method. So when it induced abortion, that is intentional abortion, here we will have be having two kind of abortion type. One is medical treatment and one is surgical treatment. Medical treatment means by taking medication, okay, and the other surgical treatment means utilizing surgical methods like curettage method and evacuation method. So in our question, the question is, as you can see, patient decides to terminate the pregnancy. So it's an induced pregnancy, that means induced abortion. So now, which procedure they have utilized? You can see mechanically evacuates. So utilizing evacuation procedure, they did the abortion procedure. Okay. So the correct answer you can see 59840 is there, 41 is there. 40 is induced abortion by dilation and curettage method. 59841 is induced abortion by dilation and evacuation method. Okay, so the correct answer should be 59841. 59841 is correct. So next, patient with the erectile dysfunction is presenting for a penile implant. A non-inflatable penile prosthesis is inserted. What CPT code is reported for this service? So this is a male genital system question. Okay, so here the question is about a penile prosthesis. So this is a keyword. A non-inflatable penile prosthesis is inserted. So please check. There is a two question on the same concept. So one question they have asked about insertion of penile prosthesis non-inflatable. Okay, if they mention non-inflatable, you will select 54400. And also they have sometime they asked question about inflatable. Okay, if the question inflatable, you should select 54401. So in the current question, it is a non-inflatable. So answer should be option D, 54400. So next, you can also see here, there one more question is there. So you can see patient with erectile dysfunction presenting for a penile implant and inflatable penile prosthesis inserted. So here question is about inflatable. So you should select answer A, 54401. This one, since they are asking inflatable. So make sure you are referring both the keywords. So next, I will also tell few important things from male genital system. So you can see there, here from destruction procedure. Okay, destruction procedure. Please check destruction of lesions on penis. The simple method. In the simple method, what kind of procedure they are utilizing? Okay, so this cryosurgery, electrodissection, laser surgery, or surgical excision. Likewise, we have to check the method and we have to assign the code. So they asked one question regarding laser surgery. Answer should be 54057. Simple destruction of lesion from penis using laser surgery means you will put 54057. And if it is an extensive, okay, extensive is nothing but little complicated procedure. This goes with 54065. Okay, destruction is important. And coming to circumcision is important. So you can read all the codes, description, and please thoroughly understand each of the codes. And there is one coding guideline here. Okay, make sure you will not forget this. 54150 says circumcision using clamp or other device with regional, dorsal, penile, or ring block. Okay, if dorsal, penile, or ring block is not being utilized, then we have to code same CPT code, but with the use of modifier 52. So we have to tell that the service has been reduced. Okay, so we have to utilize 52 modifier. And also do not report modifier 63 in conjunction with 54150, since 54150 procedure, most these kind of procedure will be performed on infants. So in infants will be weighing around 2 kg, 2.5 kg, 3 kg likewise. Okay, so 63 modifier says, you know, it based on weight. Okay, less than 4 kg or maybe 3.5 kg. So we have to check that, and you don't have to utilize 63 modifier with the 54150. Okay, sometime they'll clearly mention in the question, baby weightage also they'll mention. So by seeing the weight, do not go ahead and assign 63 modifier with 54150 procedure. Okay, so please go through all this circumcision course. So coming back to next one. So you can see next question is about maternity and delivery care. Patient took antepartum care and delivered her second child vaginally, has a history of having previous cesarean delivery for the first child. What CPT code is reported for delivery of second child with antepartum care and postpartum care by the same provider? So please be aware, in maternity care, we have some 4 kind of different scenarios. One is like completely delivering baby through vaginally. The next set is like our first pregnancy delivering through C-section. And the next scenarios are like uh, previously C-section performed. Okay, the first baby born through C-section. Next, second baby born through vaginal. Okay, that will be some set of codes. First pregnancy, the baby delivered through C-section, and second baby also C-section. Then we have a separate codes. Okay, so in this question you can see previously C-section performed, history of C-section, and now baby delivered through vaginally. That means we have to follow vaginal, that is VBAC. Okay, this code set you have to code. VBAC is vaginal birth after C-section. Okay, we have this separate code set. From there you need to take the codes. So remember, when you are dealing for maternity or delivery care codes, we have global package codes, global obstacle package codes. Okay, global obstacle package means if patient is taking antepartum, delivery, and postpartum, all the 3 care in the same clinic or with the same physician, we will be considering it as a global package code. Okay, so here also she took all the 3 care codes. If she take all the 3 care codes, you can check the VBAC set of codes. I'll just show the code 59610. You can see global package code. So this we will be coding 59610 will be the correct answer for 4th question. Okay, please go ahead. You can pause the screen, go ahead and refer all the options, and you can get the correct answer. Okay, so answer C. And this is very important. Maternity care is important, and also it's a big concept. You cannot easily explain in a single video. I mean, in this current video I have to make a separate video on that. So we have coding guidelines. I hope everybody is aware of this coding guideline. So how to report twins? Say for example, if she is delivering twins on the same session, how we have to build? There are coding guidelines for based on what kind of delivery it is. Okay, so if it is first vaginal delivery of twins, we code like this. And if it is a VBAC, that is previously C-section, now vaginal birth, and she delivering twins means we will code one global package code that includes all the three care, and one more we will code only for delivery, and we will use 59 modifier. So here we are coding extra for delivery because the physician has spent some time for delivering one more baby. Okay, so that we will only code for delivery. So you can just see here there are all the coding guidelines. So that I'll make a separate video on maternity care, and I'll explain each of everything. So coming back to our important question. Next, a 22-year-old female came to a clinic for removal of intrauterine device. What CPT and ICD are reported? ICD code I just removed because I cannot again go back and explain. So I'll tell the CPT. So okay. So 58301, 58301. So since I removed ICD code, I have just you can focus on CPT, and later if you get this question, check the ICD description and select code accordingly. Okay. So 477. So introduction. So you can see 58301, removal of intrauterine device. 58301 is the correct answer. Okay, I did not observe this. Since I removed ICD, there are two CPT, same CPTs are there. So later, maybe in comment section, I'll just see what is the correct CPT with the ICD code, and I'll add it. Okay, maybe here it is like it's an intrauterine device, right? Removal, maybe it's a status code. So some Z series code will be there, I think. I'll add that. But CPT is 58301 is correct. So next question is about you can see 45-year-old female patient came to planned laparoscopic total abdominal hysterectomy for endometriosis of the uterus. The surgeon attached the trochus, the scope is inserted, examining uterus, abdominal wall, bilateral ovaries, fallopian tube. The surgeon decides to convert the laparoscopic procedure into open total hysterectomy. Okay, so this is important. Few students, what they'll do, they'll only focus on some keywords. And here, if you directly see this says laparoscopic total abdominal hysterectomy. Okay, so after if you're reading complete question, you are getting one more point that the surgeon has decided to convert laparoscopic procedure to open total hysterectomy. That means they have performed open total hysterectomy procedure. Okay, so we have to find the code for this particular keyword. And what happened next? Because of the extensive amount of adhesions that needs to be removed, total hysterectomy was performed, and due to removal of extensive adhesion, the surgery took longer than normal 2 hours. So you can see the modifier here, 22 and 78 modifier is there. 78 modifier is unplanned return in post-operative period. Okay, so there is no unplanned return criteria here because since it's a original procedure that they are doing. We are in the same session now, so you can eliminate this 78 modifiers. And you can focus on this 22 modifier. 22 modifier says increased procedural service. So it's very clear. The provider said he took 2 hours more. Okay, the procedure took more 2 hours more to remove the extensive adhesions. So here the procedure got increased. So we will use 22 modifier. So let's cross check between these CPTs. So you can see hysterectomy procedure 58150, total abdominal hysterectomy with or without removal of ovary and fallopian tubes. So answer should be 58150 since it's total abdominal hysterectomy. Okay, total hysterectomy. We have to code option B as answer 58150. So next question is, a 60-year-old patient is treated for renal calculi using extracorporeal shockwave lithotripsy. Okay, lithotripsy is a procedure utilizing shockwave. They are performing the procedure. So it's a direct, straightforward coding. So we'll code lithotripsy code. Lithotripsy using extracorporeal shockwave is 50590. Okay. With this, also check for this ureter procedure. Okay, this ureter and also nephrectomy procedure. Okay, and transplantation, renal auto transplantation, partial nephrectomy. All those you can check. So correct answer is 50590. So many questions. Okay, one more question is there. During cystoscopy, 2.5 centimeter of bladder tumor is identified and treated using fulguration method. Fulguration means using high temperature. The documentation confirms that tumor size and technique which could best represent this service. So this cystoscopy, using cystoscopy, also utilizing fulguration method, they are going to remove the bladder tumor. Okay, so here we will check the bladder tumor size. Okay, based on that we will code. So bladder tumor size is 2.5 centimeter. So you can see here. So cystourethropy with fulguration method. So minor bladder means less than 0.5 centimeter of lesion or tumor. 52234 cystourethropy with fulguration, small bladder tumor, that is 0.5 to 2 centimeter. 52235, it's a medium bladder tumor which is from 2 centimeter to 5 centimeter. So in our question we have 2.5 centimeter. So we'll code 52235. And large bladder, it means more than 5 centimeter if they give as a lesion centimeter or the bladder tumor centimeter, you have to code 52240, like 6 centimeter or 5.5 centimeter. Okay, all those will come in large bladder tumor. 52240 you can select if it cross above 5. So in our question, since it's 2.5, we'll code 52235. Answer is C, 52235. Okay, so these are few important questions which I've taken from almost all the sets. You can go through this, and you cannot say like only you have to depend on these questions. These questions will help you to get some 1 or 2 marks. Okay, because it is like it comes in all the sets. So or else if all the question if you're getting in one set, then you will be able to definitely get 6 marks. But all are important. All are the students what they are getting, that only is there. Okay, and in classes if you join with this 6 question, I am also going to add some 30 other questions which are very important. Okay, you can see my classes. So you can see all these practice questions will be already discussed in the classes, but I'll be having, the regular classes there, and with the flow, everything will be discussed and it will be more effective. So that's all for today. And thank you all for watching this video. And like this month, I'm not planning any CPC exam preparation classes. If I plan also, new batch I'll start from April end. Okay, if anyone need complete class recording and with that material, okay, material is like this exam kind of material. So you can text me on the same number, and accordingly I'll tell you the price for that. So it will be around 2,599 for complete CPC, all the classes recording and the material. Okay. So this one, whatever the practice questions we have, that one. Yes, that's all for today. And maybe day after today, Saturday, tomorrow. Okay, by Monday, I may try to cover nervous system also. Thank you all. Please, if you are finding it useful, if you are watching it continuously, and I see the regular users that in my channel, it is around 11K. Okay, in my YouTube studio, it is showing that returning users are about 11K. That means most of you are watching videos. Maybe you are watching old videos or maybe preparing. But if you are going to appear for exam within next month or within this year, then you can focus on the playlist. Okay, I did not create more playlist. Okay, because YouTube I cannot give more time, since I'm also working with that classes and I am coming and doing all these things, means it's again for me kind of hectic only. Okay, so yeah, please do share with your medical coding friends and follow me on Instagram for more regular updates. Thank you all. I hope this video has helped you a little bit. Since I have explained almost of some concept I really covered. Yeah. Thank you all. Bye bye.